So Ziftomenib is a drug that belongs to a group of drugs called menin inhibitors. Those, I think, are some of the most exciting new agents in the management of patients with acute myeloid leukemia. So Ziftomenib seems to work primarily on two mutations, which are NPM1 mutation as well as a rearrangement called KMT2A, which used to be called AML. So around 40% of patients with acute myeloid leukemia will have one of those alterations. And those drugs, including Ziftomenib and a number of other similar agents, were tested first as single agents in refractory and relapsed acute myeloid leukemia and have led to, I think, important responses. However, the responses were somewhat limited, as you would expect in patients with the relapsed and refractory leukemia. In what we presented in this meeting is, I think, the next step, which is trying to combine these promising drugs with intensive treatment or AZA/VEN, which are the standard treatments that we use for patients with acute myeloid leukemia. So specifically, the presentation of a study called KOMET-007, which is a phase 1 study that included patients who received intensive chemo 7+3, as long as they had one of those two genetic alterations, in addition to Ziftomenib. And in this study, we have done what we call a dose escalation. We went from Ziftomenib 200, 400, 600, and we included a total of 51 patients in both KMT2A rearranged patients as well as NPM1 mutated patients. And I think it was clear from our data that there was no evidence of increased toxicity beyond what we typically see with 7+3. There was only one case of differentiation syndrome, which was well mitigated, and there were no dose-limiting toxicities or Zifto-related QTc prolongation. So I think the safety profile was good. What was very impressive is the response rate as well. So the response rate in the NPM1 mutated patients, there were 23 of them who were response evaluable, was 100%. All the patients achieved complete remission. And in the patients who had the KMT2A rearrangement, around 87% achieved complete remission. So very promising responses. We are looking forward to following this data for longer term. But based on this very promising data, a phase 3 trial, which will be a registration intent both with intensive chemo and in combination with AZA/VEN, is going to launch next year. And we are hoping that this treatment will become a standard treatment and change the face of how we treat patients with acute myeloid leukemia.